At a second Colorado hospital reporting a case of a child sick with a rare illness associated with COVID-19. Doctors are calling it multisystem inflammatory illness in children. Thankfully, it's rare because it really can cause serious long-term health problems. Symptoms include a fever, red eyes, and a rash. Doctors say it's similar to Kawasaki syndrome, which can cause heart failure. Nearly all the confirmed cases here do have a link to coronavirus. Governor Polis says this new illness is just more proof we have a lot to learn about COVID-19.
Takeaway is really how little we know about this very strange virus, this novel coronavirus, which has manifested so many different kinds of seemingly mutually exclusive and different symptoms across the world.
Very tricky. Jeff Todd at the Rocky Mountain Hospital for Children in Denver. Jeff, the governor mentioned 3 cases today. You've learned of a 4th.
Jim, the state had announced that those cases were at Children's Hospital in Aurora. We checked in with Rocky Mountain Hospital for Children. They said that they have a patient right now who is hospitalized with these symptoms. It is a rapidly changing landscape, something we are just beginning to learn about.
If you were to look at a patient with Kawasaki's and a patient with this side by side, they have a lot of similarities. The biggest difference is the age and the exposure to COVID-19.
Health experts are now calling this multisystem inflammatory syndrome in children, or MIS-C.
Fever that doesn't seem to go away, a rash, abdominal pain, kind of lethargy, maybe a decreased appetite, a rash, any of those things. Pay very close attention to it.
Dr. Reginald Washington says Rocky Mountain Hospital for Children is treating one patient for this right now who has family members that had coronavirus.
He's getting much better with treatment, and we anticipate he'll have a full recovery, but he will have to be followed for months, if not years, to make sure he doesn't have any of the complications that children with Kawasaki's syndrome can have.
Doctors say they're still learning as they go, and recognition of the syndrome only started a few weeks ago. Reviews of patients are happening, but cases are still very rare.
There's no one blood test that says these kids have this or don't have it, and there's no one treatment to give if they do have it. We treat them as they need it.
The state said today, because this is so new, they really want doctors, pediatricians, and especially parents to be able to recognize some of these symptoms so that they can treat children if they have this syndrome. We're live in Denver tonight. Jeff Todd covering Colorado First.